I'm here to explain our project title, Monitoring the Engagement Level of Hemiplegic Patients by Play Therapy. I'm Haritha Rajkumar and my batch member is S.R. Reshma. Our internal guide is M. Shamala, Assistant Professor of Biomedical Department from Vailtech Multitech, Dr. Rangarajan, Dr. Sakuntala, Engineering College. The aim of our project is to monitor the engagement of the hemiplegic patients by play therapy. The overall objective is to monitor the engagement of the patient by using accelerometer, and when the engagement level falls down, an alert is given to the caretaker. Hemiplegia. Hemiplegia is a form of paralysis that affects one side of the body. This is caused when the brain cells gets affected. When the right side of the brain gets affected, the left side of the body is paralyzed, and when the left side of the brain is affected, the right side of the body gets paralyzed. The conventional treatment procedures include blood thinners, antibiotics, surgery, muscle relaxant drugs, physical therapy, and so on. But due to this, these treatments have many side effects such as swelling, lack of outcome, and so on. So what is play therapy? Play therapy is a technique where the patient is made to play games such as video games or VR games, which activates the natural nerves of the brain. By monitoring these procedures, the recovery of the patient is fast. This came to the idea of our project. So our literature survey, our idea was based on the first paper titled Implementation and Validation of Engagement Monitoring in an Engagement Enhancing Rehabilitation Subsystem, where the patient is monitored based on their EEG, face expression, eyeball movement, and so on. Then further papers such as Novel Upper Limb Rehabilitation System based on attention technology for post-stroke patients, a wearable measurement system with complementary filter for gait analysis of patient with stroke or paralysis disease. So the proposed system. The main function of our accelerometer sensor, which is employed in the system, is to measure the movement of patient's arm through which the engagement is monitored while playing the game using gear type joystick. Based on the accelerometer output, when the patient's engagement level decreases, the system alerts the trainer or caretaker. So this is the workflow of our project. First, the subject is made to play a video game using the gear type joystick. On the top of the joystick, the accelerometer is placed, which acquires the signal from the joystick, or which acquires the movement of the joystick, which is processed using Arduino board, and when a threshold level is set below which an alarm is activated, which alerts the caretaker. This is the instrumentation setup. This is the gear type joystick above which the accelerometer is placed. The accelerometer is connected to the Arduino board, and the Arduino board is connected to the desktop where the signal or the readings are monitored. The other system enables the patient to play the game. The instrumentation description. The accelerometer we have used here is ADXL335. It is a low profile package and has and is highly sensitive. It gives 3-dimensional signals, that is X out, Y out, and Z out. The buzzer gives an alert when the threshold level is decreased. Arduino board, we have used Atmega 328, which is a 28-pin microcontroller, and here the Arduino board supplies 3.3 volts and 5 volts for the sensor connected to the board. Gear type joystick. The joystick I have chosen is Extreme Logitech Extreme 3D Pro, which is a 360-degree motions. It has 12 programmable buttons, 8-way hat switch, comfortable grip, and the game I have chosen is Flight Simulator X, which has 3 levels, that is beginners, intermediate and expert. So this is the output obtained from the accelerometer. The first 10 readings is obtained when the joystick is placed idle. The last 5 readings are obtained when the joystick is moved forward. And here the first 5 readings is obtained when the joystick is moved backward. Then the following 5 readings are obtained when the joystick is moved to the left, and the other 5 readings are obtained when the joystick is moved to the right. From these two tables we can find that when the joystick is moved forward, the X values are varied in positive direction, and when the joystick is moved backward, the X value vary in negative direction, and when the joystick is moved to the left, the values are in negative, and similarly when the joystick is moved to the right, the readings are in positive. This is the output graph obtained when the subject is playing Flight Simulator 10. The first 10 readings is obtained when the player is idle or when he is not moving the joystick, and there is a variation in X as the patient is moving the joystick to the front, and similarly the Y is idle. So when the joystick is moved backward, the X value falls down to negative, and Y is idle. So when the joystick is moved to the left, the X value is idle and the Y values drops down to negative. When the joystick is moved to the right, the Y values reaches the peak and goes to the positive. Here the Z values do not have any variations because the game Flight Simulator X has only X and Y directions of movement in the joystick. This is another graph plotted from another patient. So the alarm is set for the first 10 values, that is when the joystick is in idle condition. In other words, when the patient does not move the joystick, the alarm gets activated and it alerts the caretaker. So by this we can alert the caretaker that there is some problem or the engagement level of the patient is less. The outcome of this project is the engagement of the patient is monitored and analyzed, and it also gives an alert to the therapist when the involvement level decreases. So this is the budget of a project. Thank you.